What is the correct compression to ventilation ratio for a single rescuer providing CPR to an adult? A. 15:2. B. 30:2. C. 20:2. D. 10:2. Answer B. For a single rescuer performing adult CPR, the recommended ratio is 30 compressions to 2 breaths, ensuring adequate oxygen delivery and circulation. Which action is most important immediately after a shock is delivered with an AED? A. Check for a pulse. B. Begin chest compressions. C. Deliver 2 rescue breaths. D. Reanalyze the rhythm. Answer B. After the AED delivers a shock, high-quality chest compressions must be resumed immediately to maintain circulation. For a child victim, what is the preferred hand placement for chest compressions when only one rescuer is present? A. One hand on the chest. B. 2 hands on the chest. C. Thumb encircling hands. D. 2 fingers on the sternum. Answer A. In single rescuer child CPR, one hand is usually sufficient for effective compressions, depending on the size of the child and rescuer. What is the target depth for chest compressions in adults? A. 1 inch. B. 2 inches. C. At least 2 inches, but not more than 2.4 inches. D. 3 inches. Answer C. Adult chest compressions must be at least 2 inches deep but not more than 2.4 inches to achieve effective circulation without causing injury. Which rate is recommended for chest compressions per minute during high-quality CPR? A. 60 to 80. B. 80 to 100. C. 100 to 120. D. 140 to 160. Answer C. The AHA recommends 100 to 120 compressions per minute to optimize blood flow. If a choking infant becomes unresponsive, what should you do first? A. Give 5 rescue breaths. B. Begin chest compressions. C. Attempt to remove the object blindly. D. Call EMS and wait. Answer B. Start CPR immediately with compressions. After each set, check the mouth for the object before giving breaths. What is the correct compression to ventilation ratio for infant CPR when 2 rescuers are present? A. 30:2. B. 20:2. C. 15:2. D. 10:2. Answer C. In 2 rescuer infant CPR, the ratio is 15 compressions to 2 breaths to optimize oxygen delivery for smaller lungs. Which pulse site is recommended for assessing circulation in an adult victim? A. Radial artery. B. Carotid artery. C. Brachial artery. D. Femoral artery. Answer B. The carotid artery is most accessible and reliable for assessing circulation in an unconscious adult. When using a bag mask device with 2 rescuers, what is the best technique for an effective seal? A. One-hand CE clamp. B. Two-hand EC clamp. C. 2 fingers and thumb. D. Chin lift only. Answer B. The 2-hand EC clamp provides the best seal, with one rescuer maintaining the mask seal and the other providing ventilations. Which sign indicates that rescue breaths are effective? A. Chest visibly rises. B. Victim coughs. C. Victim's eyes open. D. Pulse immediately returns. Answer A. Visible chest rise confirms effective air entry into the lungs during rescue breathing. For an adult choking victim who is awake and coughing weakly, what should you do? A. Perform back blows. B. Perform abdominal thrusts. C. Encourage continued coughing. D. Begin CPR immediately. Answer: C. If the victim is able to cough, encourage them to continue as it may clear the obstruction. During CPR, how often should rescuers switch roles to prevent fatigue? A. Every 1 minute. B. Every 2 minutes. C. Every 5 minutes. D. After 100 compressions. Answer: B. Rescuers should rotate every 2 minutes to maintain high-quality compressions without fatigue. In a newborn requiring resuscitation, what is the correct compression to ventilation ratio? A. 15:2. B. 30:2. C. 3:1. D. 5:1. Answer: C. For newborns, the ratio is 3 compressions to 1 breath due to the primary cause being respiratory failure. When providing mouth-to-mouth rescue breathing for an adult, how long should each breath last? A. 1 second. B. 2 seconds. C. 3 seconds. D. 4 seconds. Answer: A. Each breath should last 1 second, just enough to make the chest rise without overinflating. What is the recommended rate of rescue breaths when performing ventilations with an advanced airway in place during CPR? A. 1 breath every 6 seconds. B. 1 breath every 4 seconds. C. 1 breath every 8 seconds. D. 1 breath every 10 seconds. Answer: A. With an advanced airway, provide 1 breath every 6 seconds, 10 per minute, without pausing compressions. Which is the first step when operating an AED? A. Place pads on the chest. B. Turn on the AED. C. Deliver a shock. D. Clear the victim. Answer: B. Turning on the AED activates prompts and prepares the device for use. What is the correct action if a child's pulse is 50 beats per minute with poor perfusion? A. Start compressions. B. Give oxygen only. C. Monitor and wait. D. Deliver 2 rescue breaths only. Answer: A. If a child's heart rate is less than 60 with signs of poor perfusion, chest compressions should begin. Which part of the sternum should be the focus for chest compressions? A. Upper third. B. Middle third. C. Lower half. D. Entire sternum. Answer: C. Compressions should be delivered on the lower half of the sternum to effectively pump blood. For infants, which technique is recommended when 2 rescuers provide chest compressions? A. 2 fingers on sternum. B. 2 thumbs encircling hands. C. 1 palm only. D. Alternate thumbs. Answer: B. The 2 thumb encircling hands technique is most effective for infants when 2 rescuers are present. When should rescuers attempt defibrillation with an AED in a cardiac arrest scenario? A. Immediately upon arrival. B. After 2 minutes of CPR. C. After pulse check only. D. After 4 medication. Answer: A. AED should be used immediately once available to restore a shockable rhythm quickly. In adult CPR, how many breaths should be given after 30 compressions? A. 1. B. 2. C. 3. D. 4. Answer: B. The correct ratio for adult CPR is 30 compressions followed by 2 breaths. If a victim is found face down and unresponsive, what should you do first? A. Deliver compressions immediately. B. Check pulse in that position. C. Roll the victim onto their back. D. Apply AED pads. Answer: C. CPR must be performed on the back, so the victim must be rolled over before starting compressions. When checking for breathing, how long should this assessment last? A. 2 seconds. B. 5 to 10 seconds. C. 15 seconds. D. 20 seconds. Answer B. Breathing and pulse checks should not exceed 10 seconds to avoid delays in CPR. Which pulse site is best for infants under 1 year old? A. Radial. B. Carotid. C. Brachial. D. Femoral. Answer C. The brachial artery is most accessible and reliable in infants for pulse checks. Which statement best describes high-quality CPR? A. Shallow compressions, fast rate. B. Deep, consistent compressions with minimal interruptions. C. Rapid breaths with pauses. D. Random compressions and ventilations. Answer B. High-quality CPR requires deep compressions, correct rate, and minimal interruptions. What is the maximum interruption time allowed during chest compressions? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer B. Interruptions should be limited to less than 10 seconds to maintain circulation. In a drowning victim, what is the first action before compressions? A. Give 2 rescue breaths. B. Check for pulse. C. Apply AED pads. D. Place in recovery position. Answer A. For drowning victims, initial rescue breaths are prioritized as the primary issue is hypoxia. Which condition would most likely require immediate defibrillation? A. Asystole. B. Ventricular fibrillation. C. Pulseless electrical activity. D. Normal sinus rhythm. Answer B. Ventricular fibrillation is a shockable rhythm and requires immediate defibrillation. When providing compressions to a child, what should be the depth? A. About 1 inch. B. About 2 inches. C. At least 1/3 of chest diameter. D. Greater than 3 inches. Answer C. Compressions in children should be about 1/3 the chest depth, roughly 2 inches. What is the recommended hand placement for adult chest compressions? A. 1 hand over the sternum. B. 2 hands on the lower half of sternum. C. 1 hand on abdomen. D. 2 fingers below sternum. Answer B. Both hands should be placed on the lower half of the sternum for effective adult compressions.